Trinity Green. Today is June 10th. So first we have anterior and posterior. So if the patient is standing anatomically correct with their palms out, this would be their anterior side of their body with their palms facing out. And then if they turned around, this would be the posterior side and the back of their hands would be included in that. Next we have superior and inferior. So superior would be closer to the head, and then inferior would be closer to the feet. So it kind of divides in at the transverse plane. Next we have proximal and distal. So if the patient sticks their arm out, the proximal point of their arm would be closer to their trunk, so it would be towards the shoulder, for example. And then as we come down here to their wrist, that would be distal. So proximal, distal. Next we have medial and lateral. I'll use my own knee for this since you're wearing jeans. But the medial point of my knee would be the inside part of my knee, and then the lateral point would be the very outside. So medial, lateral. So medial means closer to the middle of your body, and then lateral is the outside of your body. Next we have superficial and deep. So the superficial part of my arm would be like the epidermis of my skin, so the very outer layer. If I were to cut into a patient's arm, then the deep part of their patient would be the very deepest point that I cut into. So superficial is like the outside of the skin, and then deep is the very lowest point of the cut. Lastly, we have the transverse plane, the coronal plane, and then the sagittal plane. So the sagittal plane divides the body left and right. So if you imagine a line straight down the patient's body, it would divide it left and right. Next we have transverse plane, which divides it at a horizontal line at the trunk. And then lastly we have the coronal plane, which divides it anterior, posterior. Thank you.